Omicron infection, does it affect the lungs? As infections of the Omicron variant of SARS-CoV-2, the virus that causes COVID-19, continue to spread around the world. There have been reports that symptoms in some respects are different from those of Delta variant infections. Do symptoms really differ? What should you look out for? On November 26, 2021, the World Health Organization indicated a new SARS-CoV-2 variant of concern, which became known as Omicron. The variant has caused concern among health authorities because it appears to be highly transmissible and likelier to reinfect. There have also some worries that Omicron can bypass the protection conferred by COVID-19 vaccines. Pfizer maintains that 3 doses of its mRNA vaccine are able to neutralize Omicron in laboratory experiments, and that 2 doses may still prevent serious illness following infection with this variant. For these reasons, countries worldwide have been taking various measures and precautions to reduce the spread of Omicron among their populations. Nevertheless, within a world in constant motion, it may be impossible to stop it from spreading altogether. Some cause for optimism may be that various reports suggest that infections with this variant tend to cause milder symptoms than those with previous SARS-CoV-2 variants, such as Delta. But how can someone tell if they have the Omicron infections? Are the symptoms the same as those of infections with previous variants? Does it affect the lungs? Dr. David M. Cutler, family physician at St. John's Physician Partners in Santa Monica, to find out more about doctors' advice regarding symptoms of an Omicron infection. Dr. Cutler reiterated that symptoms vary and may not stand out in any particular way compared to signs of infection with previous variants. The variety of symptoms seen with Omicron is the same as with other SARS-CoV-2 variants. He said, "It seems quite notable that people affected by the same variant may experience quite different symptoms. Some get nasal stuffiness, others headache, sometimes body aches, and others get a sore throat." However, he noted serious lung infections appear to be less likely with Omicron than with prior variants. That may be because, unlike other variants, Omicron preferentially infects the upper respiratory tract. This may also be why it seems to cause milder symptoms, according to World Health Organization. We are seeing more and more studies pointing out that Omicron is infecting the upper part of the body, unlike the other ones that could cause severe pneumonia. He says, though cautions that more studies are necessary to confirm this. What symptoms does Omicron cause? The Centers for Disease Control and Prevention list the possible symptoms of a SARS-CoV-2 infection without specifying a variant. These are fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. However, the Centers for Disease Control and Prevention notes that this list is not exhaustive and people might experience different symptoms or combinations of symptoms. Furthermore, anecdotal reports on social media and other platforms claim that more specific combinations of symptoms characterize Omicron infections. Tips for prevention. Prevention is better than cure, so taking measures to protect ourselves and our loved ones from becoming infected with Omicron or any other SARS-CoV-2 variant is the best approach. No one protective technique is 100% effective. Vaccines, mask, distancing, ventilation, and avoiding ill or unvaccinated people are all important and effective to prevent you from getting an infection. And isolating when you are infected is critical in preventing you from spreading the virus to others.